Hi, my name is Connie Clarnes and you're watching the video Brown Syndrome, Aeitiology. In this video, I'll briefly introduce you to Brown Syndrome and we'll discuss some of the causes of this condition. So Brown Syndrome was first described by Harold Whaley Brown around 1949, and it's essentially a limitation of elevation in adduction. So if we have a look at the child here to the right, we can see that the eyes are relatively aligned in prime position. Let's move over to Lavo version, and we can possibly see that there might be a hypo deviation there. But as we look up, we can certainly see that this right eye is not elevating. So this is a Brown syndrome. Now, obviously, this also looks like an inferior oblique palsy, or it looks like an inferior oblique underaction. We'll talk more about how to differentially diagnose between a Brown syndrome and an inferior oblique palsy in a later video. But the core characteristic of the Brown syndrome is limited elevation in adduction. The difference between, say, an inferior oblique palsy and a Brown syndrome is that the reason the eye cannot elevate is due to the superior oblique in the Brown syndrome case. So in this particular instance, there's a mechanical restriction where the superior oblique is not allowing the eye to elevate in this position here, as compared, for instance, to an inferior oblique palsy, which it would be that it's the inferior oblique that's the problem, why the eye can't elevate. So a Brown syndrome always indicates, or should indicate, that it is the superior oblique that's the problem, that's not allowing the eye to move into elevation when it's adducted. You can have what some refer to as a pseudo Brown syndrome, and in that instance you're getting limited elevation in adduction, but it's actually not the superior oblique. It might be some other issue that's mechanically restricting the eye elevating in that position. We won't talk much about that in this particular series of videos. Okay, so what does cause a Brown syndrome? We can have congenital Brown syndrome, we can have acquired, and let's commence with the congenital. The most accepted theory, and in some instances you'll read in textbooks that there's still some question marks about this, but generally most agree that it may be a shortened or inelastic superior oblique that leads to the inability of that eye to elevate, and you end up with a mechanical restriction of the eye. It can also be a developmental anomaly of the trochlear complex. So here we see the trochlea. So one concept is, for instance, that this is shortened and inelastic, not allowing the eye to elevate appropriately. Or we could have an issue here in terms of the development of the complex region around the trochlea. There are a couple of other theories as well, but they're the only two we'll discuss in this particular video. In terms of acquired, we've talked about iatrogenic Brown syndromes in previous videos, and here if the superior oblique is tucked excessively, then what can happen is you can have a limitation of elevation due to a tight superior oblique. We can have various inflammatory diseases now also causing Brown syndrome, such as arthritis or lupus. In this particular instance, inflammation often creates a nodule. So let's have a look again here at the image where we have the superior oblique. If we have inflammation and a nodule developed just posterior to the trochlea, the nodule may be too large to allow it to pull through the trochlea so that we can get good movement of the eye. This can present issues for elevation in adduction. It can also cause what's called the click effect or the click syndrome, where if you repeatedly ask a patient with a nodule to look into elevation in adduction, what may happen is that at one point the nodule may click through the trochlea and you will see increased elevation all of a sudden, and the patient usually can hear the click as it actually, as the muscle actually gets, or the nodule gets through the trochlea and clicks over to the other side. So be aware that some instances, if it is inflammation, on repeated testing you could see limitation, and all of a sudden you could see it move normally. This is usually due to a nodule that was not able to get through the trochlea, and then all of a sudden with repeated movement it's gone through, and we're seeing increased elevation. You're also aware that trauma can cause a Brown syndrome. We've talked about superior oblique palsies, and remember the canine tooth syndrome or the class 7 superior oblique palsy, where you have trauma to the superior oblique, can cause a Brown syndrome. So trauma to the trochlea, trauma to the superior oblique can give you a Brown syndrome. Okay, epidemiologically, most Brown syndromes are unilateral. There is a portion that can be bilateral, and we can see here the child to the right. If we just look at elevation and adduction, so here we can see that the patient has a left Brown syndrome where the left eye is unable to elevate in adduction. Then as we move over here, we can again see that we have the same issue over here where the right eye cannot elevate in adduction. So about 10% of patients have a bilateral Brown syndrome. Fractionally more females have Brown syndrome than males, and it sits at around 59-60% females. And again, around 55% of instances of Brown syndromes, the right eye is affected rather than the left. Brown syndrome is actually not as common as Duane, so when you work in a paediatric setting in particular, you're more likely to see a Duane syndrome than you are a Brown syndrome, or you'll more frequently see a Duane's than a Brown's. In summary, the etiology of a Brown syndrome can be either congenital or acquired. To the right here, I have a list that is included in the Wright, Spiegel and Thompson textbook. And it's a very comprehensive list of the various causes of Brown syndrome, and it differentiates those conditions that cause limitation of elevation and adduction that are due to the superior oblique versus those that create that characteristic but aren't necessarily related to the superior oblique. We haven't discussed all these conditions, and you don't need to know this list comprehensively. However, it is worth you noting that there are a number of conditions, particularly obviously in the acquired setting, that cause or can cause a Brown syndrome. Okay, that brings us to the conclusion of this video. Thank you for watching.